We all know that the nurses in the emergency rooms in the hospitals are way overworked. They have way too many patients. There's too many things to take care of. So we're raising our hand and saying, let us help. Let us be somebody that you can pass this piece off to.
So in any 2-week period, network-wide, we probably see anywhere from about 640 to 680 lives. Probably anywhere from a third to a fourth of those are folks that are struggling with substance abuse in one fashion or another.
There are patients that we see over and over again, and I think that starts to wear on staff. And the hospital is basically a place where, okay, we want to get you well and then out. And I think with peer support, they are able to help those patients once they leave, because sometimes they're like, oh my gosh, if I leave here, I'm going to start drinking again, I'm going to start using again.
We want to be able to be a relief valve, not another pressure, not another thing they have to do. And recently we've developed a system that allows us to get real-time notifications from the hospitals so that we know when somebody comes into the emergency room, if they're coded in any way with a drug or alcohol poisoning, or most especially probably the overdoses, we get a ding on our iPads and it tells us that that event has occurred. So then we can call the social work team in the emergency room right then and ask if they want us to come in. But even if we can't get to that person, the social workers now are putting us in their discharge planner so that when they get their discharge, it says, call recovery outreach, here's their number. And then we also have their information so we can follow up with them later on in the community. So we can get there and we can help make those connections, and we can transport them to the treatment center right away, and then even follow up with them after the treatment center. This one is brand new with this real-time notification. I don't think anybody in the country is doing this besides Montgomery County. The peer can be someone who relates almost immediately to someone else who has suffered through the same problems.
I can tell you about the horrors of addiction and the things I did in active addiction to a counselor, and they can be empathetic. But talking to somebody who's actually done it and survived and came out the other side, I don't know, it's just a different level of understanding.
Particularly with folks that maybe have been in recovery in the past and then they've relapsed, there's a lot of shame and guilt around out there using again. And being able to connect with somebody that's got that lived experience that maybe had a similar path, I mean, that is incredibly beneficial to that person.
How do you live day to day? How do you get through this day and help yourself in job hunting and disappointments? And the peer's advantage is they have both the experience of the illness, the experience in a sustained recovery, plus additional training that allows them to help almost anyone to develop a recovery life for themselves that fits who they are.
I just took a little class here and a little class there, and by the time I had my year sobriety date, I was able to get licensed for CDCA. These are all things that, 4 years ago I would have told you that don't happen for people like me. It just don't. And it just started with a public health peer recovery supporter coming to my house and not giving up on me.
Public health has been really great about if I call them and ask them for support, they find a way to offer that support.
One of the things that we're doing in the hospitals is meeting with the people on the front lines so that we can make sure that when we walk into the hospital, we're not just somebody else coming in to bother them. And we are also putting into each of the emergency rooms a packet that has our contact information in it and what scenarios may be the best in order to call and get our assistance.
I think Montgomery County's got a very nice system between public health and the variety of other services that are in the Dayton area. I mean, we're much better off today than we were a few years back, for sure.
Our goal is to work ourselves out of a job. Our goal is to help people so that they never have to see us again unless it's to come back and brag about how good their life is going.
I know I had to do the work to stay sober, but I don't know if I'd be sober today if they hadn't not given up on me. Public Health Addiction Services helped save my life, and I'm just grateful for that.
I am a success story.
We are what recovery looks like.
We are hope,
connection,
Resilience.
acceptance.
We are here
because peers were there.
We are here for you. Please contact us.